Thank you very much, everyone, for making it possible. I know this was not a very difficult task to organize such kind of meeting in a very short span of time. So thank you, everybody, especially the people who have come from Nepal and the Northeast for making a participation in the large number. Although it's very difficult to speak after Professor G.K. Rath, I don't know from what reason Supriya, who is the scientific in charge, has taken me revenge like this. So my topic of discussion is prevention is breast cancer. What is the current evidence and what is the possibility in India? This is a very important slide for everybody who is working for cancer care in India. Until and unless we know about the problem, we can never reach to the solution. I know very few people must be aware about this statistics. Prevalence of cancer in India is 42 lakhs. Incidence is 44.5 lakh. Death is almost half, as already stated. Age group which is most affected is 35 to 64 years of age. Two-thirds of the cases present in the advanced stage when we see them as at the time of diagnosis. So we need to worry about this thing, and breast cancer incidence is approximately 1.5 lakh. You must be aware about this lady. I think nobody is in hall who may not be knowing about this thing. That is, initially I thought I will call her mother of breast cancer prevention. But seriously speaking, it's very difficult to call Angelina Jolie as a mother. So it took me, I called her the lady of breast cancer prevention. So initially when she came with the idea of going for the bilateral mastectomy and bilateral oophorectomy, it was too much of discussion, and especially in India, we are so much worried about the Hollywood stars. And especially if you talk about and bitch about the beautiful ladies, if gives you pain, sense of relief. So we talked all about she should not do that, she should have done wrong way, she should have gone for the, prevention, mammography. But ultimately in one of the paper in NEJM that shows that yes, this all kind of prophylactic surgery helps you in reducing the incidence of breast cancer and ovarian cancer. I won't go into detail because Dr. Sastry sir has a presentation related to this issue only. So coming to the breast cancer risks which we cannot control, that is the race, gender, genetics and age. I know many women are trying to control over this age. They want to hide this and they always, but I think it's very difficult as far as the incidence of breast cancer is concerned. Risk you can control. I know exercising, food. I know in today's era it is most difficult to control when it comes to food, alcohol and smoking. It's very difficult for us being working in the area of oncology. So what are the established method of prevention? First is the primary prevention. There are three modes. There's a breast cancer education which is highly needed. People are educated, but they are not breast cancer educated. They are not cancer educated. And we need to make them aware. Chemoprophylaxis in the form of chemo prevention. Secondary prevention by doing early diagnosis. How do we diagnose early? By doing the screening, breast self-examination, clinical breast examination, mammography, digital breast chemosynthesis, MRI, and tertiary prevention, that is disability limitation. Breast self-examination in India, everybody advocates it, but as far as the evidence is concerned, there is no data that it decreases the chances of mortality from the breast cancer. Although it helps you to present early to the hospital, but in spite of the fact, it also leads to the overdiagnosis. So in any part of the world, there is no evidence that they don't practice breast self-examination. In India, by the way, we say something is equal to nothing, but I want to state it very clearly. In cancer, something is equal to nothing. So you don't need to do something. If you want to do something, it will be equal to nothing. Again, important modality is clinical breast examination. There is no study till now which decreases the chances of death due to breast cancer. This is the study in Mumbai by Surendra Sastry sir, and it focused on four very important approach. When you do the clinical breast examination over the longer period of time, it helps you to present early. There was 7% increase in the negative axillary surgery. Rate of breast conservation surgery has gone up, and very drastically the use of chemotherapy came down by 26%. Digital breast chemosynthesis is nothing but the 3D mammography. It increases the cancer detection rate, but we need more. It is FDA approved, but this is not, in practice, and it is not approved. Mammography is the standard for screening what we have today, and there was a viewpoint by IRC working group, in which group it is most effective. They have found that in women aged 50 to 69 years of age, mammography seems to be more effective, and it is of some value, but it is of limited value when you do it in 40 to 50 years, and it is of no value when you do it in less than 40 years and more than 69 years of age. So these are another study published in NEJM, which talks about tumor size overdiagnosis. They came with a conclusion: it helps you to detect the breast cancer at the small size, but it also leads to the overdiagnosis. And whatever people are talking about effectiveness of mammography, it decreases the chances of death from the breast cancer. A systemic improvement is the systemic therapy is one of the very key component. So we need to look further what's effective or not. MRI and mammography, especially for the familial genetic predisposition, is better. These are the screening guideline, which is very important. How we don't have a screening guideline in India. So probably this kind of meeting and the teachers we have present here, we can develop our own guideline so that it can help people. Right now we have the standard, which is US Preventive Service Task, American Cancer Society. They usually tell, US Preventive Services Task Force, they tell, do the screening after the 50 years to 74 years and do it every too early. In contrary to this fact, American Cancer Society says if you want to do from 45 to 54, you have to do it annually, and after that you can do it by early, and it is up to 74. After 75 years, there's no role because the benefit is less. So there's a very important question nowadays. We always talk about in our clinical practice, what is the screening modality for the woman with the dense breast? So it was like in the mammogram is negative, so adding MRI, ultrasonography, chemosynthesis, does it help? Its role is still very unclear. So coming to what we have, after the interference of Prime Minister Modi ji, government announced we will come with the operational framework for management of common cancers of India. And they advised, based on one study that I showed published in Breast, that we will go for the screening of women 30 to 65 years of age, and the modality will be the clinical breast examination, and frequency will be once in 5 years. This got lots of controversy, and I strongly feel if you want to make something popular in India, make it controversial. So at least when it becomes controversial, many people are now knowing about it. So it needs to be debated whether it's a right way or it needs to be improved further. So coming to the chemo prevention, we have the tamoxifen and raloxifene, which is a very proven role and FDA approved. We have the another molecule, but it is not cost effective. So possibility of India. This is a very important question. India is a place where everything is possible. This slide will tell you what is possible in India. A tea seller can be the Prime Minister in India. Yogi can be the Chief Minister of the largest states in the country. ISRO can do a remarkable work. And your Baba, by selling the yoga, can sell the products. So these are the possibility. In another way, coming to the cancer, what is more important? You can read this thing, sebum tablet. I think this is the things that is going on in India. When these people can make something possible, why can't we? We need to promote our science. And there's another doctor, big doctor, I think, what is his name? RajivDikshit.com. And I think you can get the breast cancer treatment. These are the possibility that is going on. And in contrary to the fact, what I gain in the awareness program, that will tell you how much hard work we have to put when we go to the society to work for cancer thing. When I started telling somebody, don't eat pan, this is not a good thing. He told me pan is a good source of calcium. You don't know. If you have anybody who is having hypocalcemia, tell him to eat pan, that will be corrected. If we smoke 2 cigarettes a day and exercise for 1 hour, it washes out all the harmful smoke. Chemotherapy causes more harm than the gain, make life horrible and scary. Yoga can cure cancer. Gomutra has got lots of attention nowadays. It can act better than chemotherapy. Hanuman Kavach is a disaster. And I think people have asked me, can Hanuman Kavach help me in treatment of cancer? Why don't you take help from Nirmal Baba and Baba Ramdev from the cancer? And I can control cancer by my... These are the all statements that I got while doing the cancer awareness. Now you can think, how much hard work we have to put among the society to make things better for prevention and cancer screening. Coming to the cancer prevention and screening, mass screening, we need to think, is it really required for the 40% of the people who doesn't get food, twice in a day? If we screen also, will it be helpful? What is the best approach, population-based or opportunistic breast cancer screening? Do we need to invest more on the behavioral modification that going for the biological modification? Who should do the screening? Now everybody is telling, somebody is telling A&M should do, somebody is saying, now people are coming with the flight of ideas that it should be done by the ASHA worker. I really feel bad for the ASHA worker in a country like India, where they are treated like a guinea pig. If something is not doing something, and I don't want cancer to be put like malaria, filaria in the country, because it's a science, it's not philosophy. We don't need to distribute the drug, we need to act harder, and we need to make a difference. How to make breast cancer screening cost effective, where to go if sign of breast cancer is present. This is a major question because we have a very heterogeneity as far as the treatment of cancer center is concerned. And how to ensure diagnosis and treatment at the right time, at right place, and quality of life. There's one study we conducted among the teachers in different parts of India, and we found there is a very less knowledge about the breast cancer. But yes, cervical cancer is less known to even educated people rather than the breast cancer. But yes, after the 1 year of continuous awareness, the practices increased, and their knowledge about breast cancer increased. So awareness is much needed, which is undebated. And what we need, brand ambassador, because we have so many brand ambassador for selling gutka, but till now we don't have a brand ambassador from promoting cancer care in a country like India. Media and help is needed to reach the large number of population. Medical fraternity should act as a role model. We must screen ourselves, and we must ensure that we must screen our family members so that we can show other people that yes, we are involved. Then afterwards we have to go to involve the other people. Theatre and cinema has done so much work as far as the HIV and TB is concerned. So this area needs also attention by them. Cancer and addiction and awareness about alternative medicine, when to use, how to use. So I will conclude my talk with my last slide of the NIH presentation. Nowadays, cancer has become a public health concern. No one predicts life and don't know about our turn. We all should try to keep ourselves healthy but alert, because ups and downs make life a beautiful concern. Cancer is close to our life and touches our emotion. So working for cancer needs passion and much dedication. Cancer needs close one support to fight and helps to convert many odds to right. This is best disease someone can cure, but for hypertension and diabetes mellitus, as Dr. Raj said, I'm not sure. Patient has to present early to make the difference, in spite of the fact they have too many hindrances. We all have to work together to ensure cancer care reaching every woman and man. As even President Obama says, yes we can, yes we can. I know it's a Trump era, but I'm taking Obama name. Thank you.